morning, everybody. This is part of our series on Shivambu. We have got with us a very dynamic person, one Mr. Gadakari, who has been practicing Shivambu for many years. And he has been kind enough to consent and give us this interview for you all to be able to appreciate the benefits that he has experienced. And he is here on this platform today to share his feelings and experiences about how Shivambu, he believes, has helped him. And I'm sure all of you would be enlightened and may use this as an inspiration for your own personal journey towards better health. So let me introduce Sri Gadakari to us. Namaskar.
Namaskar.
How did you get introduced to the topic of Shivambu to help you consider that as an option for life?
I think it was in early 20s that I got introduced to one Mr. Nagauda.
Okay.
He was a yoga exponent and a very high level of yoga he used to perform. During our discussions, he told me that once he had lost himself in a jungle.
Okay.
And for 10-15 days, he was completely in that jungle and he had contracted jaundice. He cured himself of jaundice only by taking Shivambu.
Yes.
Only access to him at that time was a coconut shell.
He didn't have any option other than that, and he did that and he got cured.
He got cured.
Correct.
And he was there right in front of me, telling me all the advantages, how he did it.
Right.
And I took to whatever he was saying.
Yes.
Then I got a book, Shivambu Kalpavidi in Marathi.
Okay.
I think it cost me some 20 rupees.
Correct.
I read it, I found it very good, and that book had referred to one book of Water of Life by Mr. Armstrong. And then I bought that book also. It was quite in deep. I don't think I read that book in full, but I think that was sufficient introduction for me to get myself started.
Correct.
And since then, this journey has started, and almost last 40 years.
So you've been practicing Shivambu for
40 years.
Fantastic. Okay. Now, since you have been practicing Shivambu for so long, what are the benefits you have seen along your journey for yourself?
First and foremost, I will say is it is a fantastic medicine for your liver. I am a foodie.
Yeah,
I
love food.
I love food. I travel 50-100 kilometers just to eat my favorite misal somewhere.
Okay.
Yeah. So,
true foodie.
Yeah. From here I go to Thane to eat Tahsildar Mamledar Kachari misal.
Okay.
In spite of all these, should I call them dirty habits? I don't know, but then
unusual and
yes.
not orthodox habits which can influence people negatively on their tongue.
So I have been able to continue all this. I think it's primarily because of Shiva.
Okay, so you feel with Shivambu practice, your health has been so robust that you do not have problems wherever you eat, whatever you eat, all hours you eat, etc.
Vada pav, I love vada pav.
Yes.
I can eat 2-3 vada pav even at this age and enjoy. I eat very hot non-veg, spicy non-veg. So I think I have been able to sustain it, digest it with the help of Shiva.
Okay, alright, that's great. Now, you also do making Shivambu.
Yes.
What are the benefits you have noticed?
See, sometime after I started on Shivambu, some 10-12 years after that, I was doing a course of Yoga Vidyanam. There they taught us Jalneti.
Correct.
And while practicing this Jalneti, I had to make the water lukewarm and salt to it.
Correct.
I was already taking Shivambu and I thought, why not experiment this? So, last almost 30 years, I practice Jalaneti, I mean Shivambu Neti I will call it.
Correct.
And again, that has given me remarkable effect as far as cold and cough is what we call Sardi person.
Yes.
I am rarely required to visit a doctor for this.
Correct.
So I have been practicing this, and also with that I gargle with Shivambu so that if there is any throat infection it gets cured.
Correct. Just confirming that, what I want to express is the difference between warm saline water, which is salt water, and Shivambu. Saline water has got only salt. Shivambu has got all the ingredients that are in the blood, which we have discussed in one of the episodes. And because of those micro ingredients which are all effective, which are in the blood, the tendency of the body to fight off disease. Now, as we were discussing this morning, Shivambu does not kill bacteria. Shivambu does not kill virus. But like we use morphine for mosquitoes, they have it there, and when that fragrance is there, they go away. Okay. So like that, the viruses and bacteria become inactive. They are not prepared to act in that area. So they go away and they leave you alone. And on that basis, I can totally agree that Shivambu Neti would have been a lot more potentially powerful in your living experience of it.
And during last 3 years, particularly in Corona times, I think it has been such a magnificent help that I can go anywhere without ever this fear of contracting Corona.
Correct.
Because, and let me tell you, sir, if ever I went to, let's say I went to Lobitala. It's a very crowded place in
very crowded place.
Yeah. Despite Corona, there used to be people used to be thronging that area.
Yes.
The moment I used to come home, first I have my Shivambu Neti. I am sure I am not going to be contracted.
Correct.
Such was the, I will say,
confidence. Correct. Now your confidence is perfectly valid. I myself totally agree with that. Unfortunately, the common man and the public at large in terms of the medical profession needs statistics. And that part is not on our side. So we cannot claim that it will do for everybody, because the problem we have is people will half listen, do a half native in one nostril and then say, I got COVID and it was useless. So we don't want to get into that controversy. But definitely for our viewers and especially Shivambu followers who may be practicing Shivambu Neti or who might be practicing Shivambu regularly, if you all have experienced that during this 3-year COVID period you have been free of COVID, we would really like you all to contact us, because then we can collectively stand up and say we have got 500 people who have been practicing Shivambu and did not get COVID. In next episode somewhere we can include that as authentic data. Because then it is robust, then nobody can argue with that. Okay. Now, what are the other things that you might have noticed changes in you? Did you notice changes in flexibility, having a sattvic attitude, peace of mind, anything else?
General well-being, I will say. Overall, I would love if I become sattvic through Shivambu. I don't see any, at this moment at least, I don't see I have any sattvic or something. Yes, I have been practicing meditation for years, and but I don't know whether it is a result of Shivambu or not.
See, so it is very hard to define and delineate it when this transition happens. I'll give you a simple example. We have got live examples of people I teach and people who practice. People have taken Shivambu, people who are observant have noticed. They go off non-veg. They used to love non-veg. They used to love non-veg. Now if they eat non-veg, they feel, okay? And they have come to me and said, this is happening, what is wrong? I said, nothing wrong, your body is going to sattvic now. And funny thing about Indian way of life, Bharatiya Paddhat, or Hindu system of education and philosophy, nowhere in our literature has anybody said, because of our religion you should not eat non-veg. Okay? Nowhere in our literature has anybody said you can eat non-veg and be very healthy. When it comes to very good health and sattvic food, they specify. Don't eat non-veg, eat on time, eat less, eat only 1/3 or half the appetite you have. Those rules are different for different people. So what we have noticed is that sattvikta, and the reason I asked you about the spicy food was, this particular person used to love spicy food, and today he has gone off it. And because of that, now I ask this question, because now that it has been brought to me that such things are possible, then we need to see whether more people are experiencing that. And if they are, then I can add and say, yes, it does do sattvic and it slowly changes you. Problem with Shivambu also is because you're taking it over a long time, you don't realize how much change is here.
Yes.
Has happened to you. Very classic thing that we have noticed, for most of us, not 3 of us, we can definitely confirm that. If we do any heavy exercise, even if it is unusual, I haven't done any workout, I haven't played any games, and I suddenly go and play tomorrow, the next day we don't get stiff.
Okay.
But if you don't take Shivambu, you feel, I'm feeling stiff, all the muscles are tight. So something somewhere, the lactic acid formation, the collection and all that is being overcome. Now problem we have is, we don't know how it works. We know it works.
Yeah, it works.
We don't know how it works. So we are in the process of tying up with people to see if people who are interested maybe wanting to look at research as to why is this happening, and somewhere in the future this may happen in the next 5 10
That kind of study should take place.
Right. But we are making this observation public because somebody then can look at it and say, this happens. Some athletes may take it up and say, we'll try. And when they don't get, when they get positive results, they say, this is happening, boss. Now the scientist community will start making up here, there is some magic thing. So let us see. Okay, is there anything else you would like to tell us about you, your experience or Shivambu?
I also use Shivambu for treating minor wounds.
Right, external.
Yes, external.
And you use fresh or
fresh?
Fresh, okay.
And it does so, it's like I use it in lieu of Dettol, let's say.
Correct. As an antiseptic. Correct.
And sometimes we get some injury here,
Yeah.
and some nakoda and all.
Yes.
On the thumbnail, many times on thumbnail it happens.
Yes.
And I have been largely able to cure that through Shivambu application.
There are others also with that, and some of those instances will be on our series. So you might be very interested when you follow up how somebody who nearly lost their finger, which was blue and black, and going to be cut off by the doctor if in 1 week he didn't respond. The doctor was amazed to find, what's your name? What did you do? So yes, miraculous results are there.
That reminds me of a childhood episode. I was hit by a stone here, and all my friends urinated on my head.
No, this is common. I remember a Vaidya in Pune, he's no more now, in Panvel, and he came from a very poor family. And he was at a circus. And at the circus, employee or somebody got cut. And he was bleeding. And this young child said, just piss on it, man, it will be okay. And this was heard by a Vaidya, which the Vaidya found was an unusual comment for a young child. So now the Vaidya followed the child all the way to his family where he was living, either their parents or he was living with uncle or something. He followed them there. They said, can I have this child? I'm going to take him and make him Vaidya. And when I met him, he was in his 70s, I think. Vaidya for so many years. Yes. These are common sayings in our traditional cultural mores that we have. That we don't give weightage. But in Marathi, I will describe it. If you have a cut with a mukta is what they say. It's a common saying. But over time, last 50, 100 years, it has become a forgotten. So, or even same thing with insect bites. If you have a bee sting or an ant bite or something, if you piss on it and then rub it in, the reaction is reduced. It won't go away, but the reaction is reduced, all your itching and everything. So, there are tremendous potentials, but all this has to be quantified, studied, and presented in the right light so that everybody can make maximum use of it. And that is the intention. Is there anything else you would like to add? Anything at all?
All I'll say is that it has been a fantastic medicine for me for the last 40 years. I have not required to go to a doctor.
Yes.
My sugar pre-meal, post-meal is same, no blood pressure.
But that is very interesting. Your sugar pre-meal and post-meal is identical, you say.
Same.
Yeah. That is something interesting. Now that doesn't mean you want diabetes to suddenly give up their medication, okay? But if this can help you with your diabetes, you should consider it as an option and then follow up with your doctor, and as your sugar improves, they can take your medicines. That's phenomenal.
I think these are some of the advantages.
Yes.
I mean, if you ask me to establish a direct connection, I will not be able to.
That's okay.
But I think this is how it has helped me a great deal.
I was smiling in your conversation with every one of the guests we have had. For me, Shivambu is so good, and we hope you can make use of it. It's the final message everybody is giving.
Yeah.
So on that note, on a smiling note, let us thank Sri Gadakari ji for giving us his valuable time and his thoughts and personal experiences to share with our viewers. And we hope you as viewers make the most of it. It's up to you now to decide what you want to do. But we are giving you the raw knowledge and the raw data that we have. And we have also pointed out that research in some areas needs to be done. So we wish you good health and happiness, and hope Shivambu can make better quality of life for all of you. Thank you.
Thank you.